for joining us today for this webinar hosted by the Canadian Spondyloarthritis Association, the CSA. My name is Brenda Delodder, and I'm the Executive Director with the CSA. We are thrilled to have you with us as we delve into a critical topic that affects many individuals living with spondyloarthritis, and that is the importance of access to new treatments. Spondyloarthritis, as many of us know, is a complex and often debilitating condition that can significantly impact the lives of those affected. It is the most prominent form of inflammatory arthritis, with more people in Canada living with the disease in comparison to that of rheumatoid arthritis. And today, more than 500,000 Canadians live with this incurable disease. With up to 50% of patients becoming resistant to their treatments within 5 years, it's really important and crucial to discuss the barriers to accessing new therapies and the implications that has on patient care and quality of life. And today we aim to highlight some of these challenges. I am absolutely thrilled and honored to introduce our esteemed guest. We have Dr. John Chan, a highly respected rheumatologist. Dr. Chan is a clinical investigator with Arthritis Research Canada. He has a clinical focus and research interest in the areas of axial spondyloarthritis and psoriatic arthritis, among others. His research really focuses on early identification, which we know is all too important. And he's involved in the SPARK and IPART, which follow patients with spondyloarthritis and psoriatic arthritis. Thank you, Dr. Chan, for being with us today.
Oh, my pleasure.
So I want to turn to you and really talk about the fact that research has indicated that 50% of some patients with spondyloarthritis can build resistance to their medications within 5 years. Can you explain what it means for a patient to become resistant to treatment and why this occurs?
So we have fantastic therapies, and they're not 100% effective, but for quite a few patients, they'll respond very well. Improvement in pain, stiffness, inflammation markers come down. But over time, we see that there is a little bit of what we call attrition, right? So if you just continue on therapy, roughly maybe about 10% per year or so, it may lose efficacy over time. And so reasons for that, it's not always easy to tell why, because one major factor is development of anti-drug antibodies. So we know that our immune system is great at fighting infections. They form these antibodies, which are kind of these protein structures that help bind and clear out pathogens, viruses, and bacteria. But over time, you may develop antibodies to the drug, and your immune system might say that doesn't belong here and clear it out. Now, that's not the only mechanism of why we lose efficacy over time. Sometimes the disease finds a new path, right? There's they're pretty complex diseases, and we've discovered certain pathways that inflammation is propagated or driven forward. But there probably are a lot of other pathways that we still haven't yet identified. And so it might just, like a brook trying to get to the ocean, it may find another path in some cases. And sometimes it's a matter of, especially in patients with inflammatory bowel disease, sometimes they have increased drug clearance and they often need to crank up the dose as well in certain situations.
Interesting. And now I wonder if you could share with us, what are the most common treatments available for spondyloarthritis today?
Yeah. So we generally start with non-pharmacologic stuff, such as core exercises, weight loss. That can be very helpful for many patients. Anti-inflammatories would kind of be the next step, by which I mean Advil, Aleve, Celebrex, diclofenac, meloxicam, those types of medications. Those can also be effective for some, but if patients still have quite severe pain, impact on their function, there are more targeted therapies that are quite a bit more effective. And so scientists have discovered certain inflammation chemicals that our immune cells talk to each other with, and they kind of excite each other, kind of like people at a party. And so there's quite a lot more of these cytokines that are floating around. And so some of the treatments we have are biologic. So those are man-made proteins that specifically can bind onto those inflammation chemicals and kind of bring them back down and calm everyone down at the party. Some of the other agents, we have JAK inhibitors, which block the receiving station within the cell. So these inflammation chemicals are whizzing about. They land on a docking station and send a signal to the cell. And so the JAK enzyme is kind of the docking station that triggers that signal. And so there are oral medications now that can inhibit that signal from getting sent. And so those are kind of the main mechanisms that we have for managing. And then there's a lot out there about, just diet, exercise, supplements, meditation. Can that help? And there may be some role for that. It's just not as well studied. And many patients have kind of anecdotal experiences saying, if I cut this out or add this to my diet, that helps. And there may be something to it, but the diet is very difficult to study. And so it's hard to have a strong recommendation for that.
I know that there's a lot of interest right now in alternative therapies as well amongst the members of the CSA. Now, on that same thread of medication, why is it crucial for spondyloarthritis patients to have access to new treatments as they become available?
So, as you mentioned earlier, this condition can be pretty debilitating for some, not for everyone. Like, there are many patients with very mild disease that don't need medication. They might be able to just do exercises alone, and that may be sufficient. But for quite a few, it can impact quality of life and cause things like disability, impairment in work, or presenteeism, where people show up to work but can't function to their maximum potential. And we know that a lot of these treatments can help improve pain, function, and quality of life for a lot of patients. So it's important to get things under control so that we can live good quality of life. And we, as you mentioned earlier as well, if you treat earlier, people tend to respond better. So if you've got someone with severe disease, you do want to get on top of that earlier. If you wait 20 years, their probability of response does go down.
Yeah, that's such a great point. And the delay to diagnosis is significant right now. So that's something that we're also working towards reducing significantly. And the struggle, right, with people being able to maintain employment, has this broader impact on the economy as well. I'm wondering if you could talk a little bit about some of the comorbidities of spondyloarthritis.
So we know that this condition is associated with other types of autoimmune diseases as well. So about 40% of patients who are untreated can develop inflammation of the eyes, what we call uveitis, typically anterior uveitis. 5 to 10% can have psoriasis, a special type of skin rash, and inflammation of the bowels, Crohn's or colitis, and about 5 to 10%. And so, there are also other, not directly related conditions, but we know that inflammation is not good for the heart. And so there are a number of studies showing that there is a slight increased risk of cardiovascular disease, of blood clots, things like depression. I think for individuals who are in chronic pain and their function is impaired, their mood tends to be lower. And other associated comorbidities, fatigue, increased body weight if they're not able to exercise because of pain. We don't know if they're directly related, but they often come hand in hand.
Yeah, definitely. And, it impacts, people's lives in their individual households, as well as employers and productivity. And that has that ripple effect into the economy and communities as a whole.
Yeah.
So I'm wondering if you can share some insights on how people can work with their healthcare providers so that their treatment plans are tailored, because everyone's unique and different.
Well, are you meaning their family doctor or their rheumatologist?
Yeah, so we can start with the rheumatologist. How can they work together with the rheumatologist?
Yeah, I think having a good rapport with the rheumatologist, making sure you have someone who understands how this is impacting your daily life, your function. I think doing regular blood work when appropriate is important. Close monitoring, because all our treatments have some potential side effects. And then, I think also being an advocate for yourself as well, especially if it's impacting things like sleep, mood, ability to work, if people are waking up frequently from sleep, or they're cutting things out of their life, they're unable to exercise. I think those are all things that are not easily captured in questionnaires that we often do, but do reflect significant impact on life.
Absolutely. And self advocacy and empowerment is such an important piece, to navigating this disease. So really appreciate those insights. Just want to touch on our final question here, and that is, I'd like to know your thoughts and your hopes for the future, and what advancements and treatments are you most hopeful for in the coming years?
Well, I think there's advancements in the area are constantly happening. I think there are changes in terms of the quality of the imaging we're getting, so we're able to detect things better. We heavily rely on MRI as an imaging tool, but we know that there are some patients who have evidence of inflammation in the blood that we can't detect on the MRI. And there's a question of what if they don't have it in the blood? What if the MRI is negative? Could they still have it? And that is a subset of patients that are sometimes hard to identify. In terms of treatments, you alluded to dietary changes, and I think there is a lot of interest. We know that a lot of the bacteria in our gut, the microbiome, are implicated in a lot of the inflammation chemicals that are produced. We're still pretty far from understanding what we can do to kind of impact that. Whether eating certain foods may kind of fertilize the good ones and starve out the bad ones. But I'm hopeful that over time we may have a better understanding of that. The holy grail is drug-free cure. That's the goal. But
Yes.
I think the time will tell, and I think we're also getting new agents as well that are coming through that may help, especially as you mentioned, patients who've lost efficacy or have not had sufficient benefit from the currently available treatments. I think that's important.
Absolutely. Well, thank you. That was our final question, and I just wanted to wrap up here. Wanted to mention just before I provide our closing comments is that the CSA works really hard at advocating for new treatments to become available, and then for there to be equitable access for those treatments. Thank you all for joining us today for discussion on access, and thank you, Dr. Chan, for sharing your insights into the importance of new treatment options. You've highlighted some critical areas here for everyone to reflect on, and I encourage everyone here, whether you're a patient or a healthcare provider or a supporter, to continue advocating for yourself, just as Dr. Chan had mentioned. There are some empowerment tools on the CSA website. We encourage you to go there as well. And really, it's up to all of us. It's a collective effort to keep this dialogue moving forward and working together toward a future where every patient has timely, equitable access to the treatments that they need. Thank you very much.
Thanks for the interview.